Good day. I am Dr. Rose Cabaluna, student nurse from University of St. Anthony. So today I'm going to perform the administering oral medication for the client. So before giving a medication for the client, as a nurse, we should first do is to do a hand hygiene to protect or to avoid the cross contamination for the client. Then of course check the oral medication sheet or the prescribed medication written on the sheet that the physicians ordered for the client. So as indicated to the sheet or the um, oral medication sheet is the client will be given a acetaminophen or the paracetamol 160 milligrams uh, and by mouth twice daily. So I will be given a medication for the client from 8:30 to 8:30 a.m. to 8:30 p.m. after meal of the client. So after checking is first, so this oral medication is the most comfortable or easiest way of giving or giving a medication for the client, because we have different route for giving a medication for the client. We have the sublingual, intravenous, intramuscular, and etc. So um, we have also the 10 rights of drug administration that as a nurse should know. First is the right patient. Of course, we should know if as we entering or enter the patient room, we make sure that it is the patient or the assigned patient to you. Like after entering, we will going to ask that, Ma'am, I am just Nurse Cabaluna from University of St. Anthony, and may I know your name po? Your age po, so that we will go into so that malalaman natin if that is really the patient was assigned to us. Then next is the right drugs or the right medication. Of course, as written and the prescribed medication or in the medication sheet of the client, we make sure that it is the right medication that physicians order. So like acetaminophen 160 milligrams, one tablet, or what we call the paracetamol by mouth twice daily. Then the right dose, so yun na, sinabi ko, right dose as the physician's order, how many doses of drugs will be given to the patient. Then of course, the right route or the right route if it's oral, intravenous. So today we're going to do the oral medication, so of course the route is oral. Then next is the right time. Of course, we have this time to make sure that we're following or ensuring the effectiveness of the um, medication. Then of course the right documentation, as after we give the medication to the client, we will go into document what we did or where we give to the client, so that we'll know that kapag may documentation, ibig sabihin nagawa na natin yun sa client. If wala naman, ibig sabihin is hindi mo pa yun naibibigay or na-fulfill for the client. Then next is the right to clients to educate. Of course, while giving the medication, we're going to say to the client like, Ma'am, this medicine will help you to relieve the pain and to lessen your fever. So of health education, which is means that we're going to teach the patient the proper way or reason why we're giving these medicines to the client. Then next is right to refuse. Of course, the client has the right to refuse if he or she doesn't want to take that medicine. But make sure as a client or as a nurse, we make sure that the client or the significant others will put their signature over the printed name to make sure to know that they really declined for not taking that medicines the doctors ordered for them or for the patient. Then right to assessment, of course, assess the client after giving the medications. If um, if may something bang nangyari sa patient after taking that medication. So as a nurse, we make sure na bago tayo aalis, at least 5 minutes so that we can observe if may something na nangyayari sa patient natin. So, and lastly is the right evaluation. Of course, every hours or every 2 hours or 3 hours, we're going to evaluate the patient for good outcomes or bad outcomes na nangyayari sa katawan niya. So now, before giving a medication to the client, as written on the medical sheet, we're going to give acetaminophen, 160 milligrams, or what we call the paracetamol, 160 milligrams tablet, and twice daily. So I'm going to give it to the client from 8:30 a.m. to 8:30 p.m. So before entering the room of the client, make sure that we already put the medicines needed for the client. So I have here the medical cup, and here is the medicine. So assuming that I already put the medicine here, then I am now ready to go to the patient's room. But first, I am going again to wash my hands or to put some alcohol. So, good day, ma'am. I am Justin Rose Caballona, student nurse of University of St. Anthony. So, I am the assigned nurse for you today, So, today po, we're going to do the oral medication sheet or the oral medication or administering oral medication on you. But firstly, ma'am, may I ask what is your name po? Your age po? So, assuming that the client already responds, so, ma'am, Dr. Santillan ordered a acetaminophen or what we know the paracetamol. So, the dosage po na binigyan niya is 160 milligrams or yung doses niya. So, ang sabi niya po is twice daily niyo po itong i-take. So, I'll give you po 8:30 a.m. to 8:30 p.m. pagkatapos niyo pong kumain. So, I have here po the medicine that Dr. Santillan was given. So, but firstly, before giving the medication to the client, of course, papaupuin po muna natin siya so that he will be going to take that medicine in a good way or magiging comfortable siya sa pag-inom sa medication or sa medicine. So, ma'am, here is the 1 tablet of acetaminophen or paracetamol. So of course, before giving the medication, as a nurse, we were going to observe if the patient able to swallow or to take a medicine by mouth. And of course, we're going to ask if he or she has an allergy. And of course, so after giving the medication, ma'am, of course, giving water. Then after that, ma'am, I'll be here for 5 minutes po. I'm going to observe po if may nangyayari po ba or may effect po ba sa inyo yung medicine na ibinigay ko. Then, tapos nyo na po nainom, so I'm happy or glad na inallow or hindi nyo po dinecline yung pag-take ng medication or medicine that the doctors ordered. So, after 5 minutes of observing, so, ma'am, as I observe naman po, wala naman pong effect yung medicine sa inyo or bad effect. So, I observe na hindi naman po kayo nangangati, right? And, so, you're comfortable. So, do you want na po bang humiga? So, after that, para maging makatulog na din naman si client kasi after taking medication, we all aware na aantukin talaga tayo. So, as of that, so ma'am, at 8:30 p.m. po, babalik po ulit ako as a Dr. Santillan's ordered. So, thank you po ma'am for your cooperation and see you later. So, of course ma'am, after 3 hours, babalik po ako dito ulit and mag-observe po sa inyo again. So, thank you po. So, after doing the procedure or giving the medication to the client, okay, so of course, documents, and we have here the oral medication sheet. Under this, meron po nakalagay na date, which is today, 11/19/2021, then so I give the medicine po at 8:30, so I'll put my initial here or my signature to make sure or as indicated na naibigay ko po that time yung medication or medicines na kailangan na i-take ng patient. So, after po nyan, documentation and check for the evaluation. If after 3 hours, babalik tayo sa patient room to check if okay po ba siya or to provide an assessment. Then, after that, at 8:30 p.m. po, bibigyan na din po ulit yung second Medicaid or yung pangalawang pag-inom niya doon para po to completely lessen the fever and the pain that the patient is experiencing at that situation. So, that's all po for today. Thank you po.